Am I audible? Hello?
Yes, ma'am, you are audible.
Yeah. Okay. So, uh, just I I will just share my. All right. So, thank you, Jyoti, for the nice introduction. We go back a long time, right? All right. So, today I am going to share a case of autoimmune vasculitis. I chose this case because I wanted to share with you all my shortcoming in the initial years when I got this case, and how learning different methodologies helped me go back to this case and then get much better results. So this is the case. I will just, so this patient I'll just explain in brief. She is actually a resident of Pune. So she came to me in 2018 with some problem of the pain in the left arm and all. So, okay. So this was in 2018. So she was not, she had been to many doctors. She had this pain for the past, since 17 or 2017 sometime. And she had been to various doctors. Somebody said carpal tunnel, somebody said some other nerve problem and all that. Somebody said arthritis. So she was quite confused and lost. So when she came to me, she had these one of the doctors did put a question mark that it could be autoimmune vasculitis. So now, if maybe if all of us have some idea about vasculitis, it is not a very sharply defined condition. So this can happen. Vasculitis is nothing but inflammation of the the blood vessels. Could be arteries, could be veins. So it could be a standalone condition, or it could also be a symptom of some other disease in some other autoimmune conditions, also in arthritis. So when she came to me, I took this case as maybe this looks like a vasculitis kind of a thing. So her complaints were that she had severe pain in and swelling both upper limbs from shoulder to her fingers, and it was more severe on the left hand side. She had severe swelling and numbness, and she could not lift her hand. So, and also she could not keep her arm hanging down. So the pain started from the scapular angle and it goes all the way to the fingers. Also, other complaints that she had was she had a history of migraine, which was like 1 week before the menses, she used to get one episode of migraine. It also used to aggravate on very fast walking, very loud noise in some weddings or something, and also very harsh lights. Also, she had occasional blocked feeling in the ears. She had ringing sound in both the ears. There was a history of drooling of saliva at night, and also she did not have vertigo as such, but she said that whenever I walk, I sometimes feel that that I might fall. So there's a slight sense of imbalance. So this hopeless feeling she had, because she had been to many doctors and nobody was able to diagnose her, and she was not getting better any which ways. So this was a condition that whether I get okay or not. So there came a point when the pain was so severe that she could not even lift a glass of water. There was a time when she had to be given her meals. Somebody had to feed her actually, because she could not even hold a spoon by herself. And her sleep was disturbed because she could not sleep both the sides. Sideways sleep was impossible for her. So this was the case in short. Now coming to her emotional state. So what I got from her after the long case taking was that she was a very emotional person and very dependent on her family. So she lives in Pune. Her maternal family is in Gurgaon, and she lost her father around 6 7 years back. This was like when she came to me in 18, she had lost her father 7 years back. So that was one grief which was still very raw and strong in her. So she could not get over the idea that, and she was not here when the father expired. So that was a very big thing for her, that I'm so far away, ऐसा भी होता है that, you know, when you lose your family, you are not even there to witness that or whatever. So also she's the youngest in the family. Her brothers are quite older to her. So she has been very much pampered. So she comes from Pune, stays here for, you know, months together. Like in the COVID time, 19, 20, 21, she was here almost 6, 8 months. So that was the kind of attachment she had with the family. She's a homemaker and she has a 10-year-old son. So all these years she never have any career as such. She had this urge to, you know, start something to make, and she said मुझे अपना कुछ तो करना है, no, इतने दिन तो as my kid was young, small and all that. So now but with this condition she tried some freelancing HR work and all, but because of her problem of the vasculitis issue, she could not use the keyboard, so which made things very difficult for her. And her menstrual cycle was regular and there was no pain as such. The periods were quite okay. So this was the first case taking I did in 2018 when I got all these symptoms. So I repertorized, you know, maybe then we were not very, we had not honed our skills, so to say, with all the different methodologies, the, you know, what I call the Bombay School of Homeopathy, all the TOS sensation and synergy and everything. So I took all the symptoms. You can see the repertory chart. I took everything and then I came out with the chart showed, just threw up all the basic polycrest remedies. So we had sulfur, pulse, phosphorus, lyco, bell, mercury. So I was like, you know, I was not sure what to now prescribe because I could not get, you know, a clear picture of what the case is all about. I could not get, that was my shortcoming. I mean, maybe the patient was telling me everything, but I didn't, I lacked the, the knowledge to grab of all the symptoms and then come to some drug picture. So in my understanding, what I did was I could not, from the repertory chart, I could not make out which one to prescribe. So I just thought of reading all the drugs which are meant for, you know, all the inflammation of the blood vessels. So to my understanding, I came up with Vipera. That was in 2018. So I did give her Vipera for 5 days, 200 potency. And then after a month's follow-up, she was somewhat better. There was some relief in the pain, some swelling had come down marginally. So I again repeated 1M. Again, after a month, not much of a difference. I mean, 2 months is a good time to understand how whether the remedy is actually working for the patient or not. So, and at around this period, then she lost touch with me, maybe because she was not getting enough relief. So she again went back to different allopaths and stuff. So in this period of 19 and 20, she also underwent some radial nerve surgery. Some orthopedic, some neurosurgeon told her some radial nerve issue hai, so you have to undergo surgery. So she went and underwent the surgery, left arm. Again, post surgery, there was no relief. The pain was still there. The swelling was still there. So she was again on steroids for quite a while. So all this, you know, like she was going around trying to search for some relief. So she again came back to me last year in 21. She was here during the Corona time. She was staying with her brother's family. So finally, she came back to me telling me about the whole surgery thing and the steroid thing. And she said that I'm not getting relief from anywhere. Please do help. मतलब कुछ तो करो, मुझे कुछ तो relief दे दो. So this was when I again took the case, had a relook, tried to really go through all the symptoms, and then again re-repertorized, and also tried to justify this repertory chart, because sometimes, you know, repertorization can get quite mechanical. I mean, I hope you know what I mean. Every time we can't just totally rely on the repertory chart. It does give a very good idea, but somewhere I felt that I need to kind of validate this also along with my understanding of the patient as such. So if you see this repertory chart, this showed up Natramure, Bryonia, Sepia, Phosphorus. So again, these are polycrest, but then
Dr. Jaya, sorry
Yes?
to interrupt.
Yeah,
Before
yeah.
you go to next slide, you can ask audience their opinion if you want.
All right. Okay.
Yeah,
I'll do
thanks.
that. Okay. So I'll just explain this repertory chart. So I came with Netramure, Bryonia, Sepia, again polycrest. But then I applied my understanding of what all we learned in FCH about the kingdom classification. I think most of you might have at least either are you aware of this, or you might have heard about these all sensation and synergy and everything. So if I mean any one of you can just share with me whether you are aware and familiar with all these new methodologies within the classical framework. Anybody?
She can be from Nitram line of development,
Yes.
yes. Where she has loss of her father and grief from that.
Right.
Not wanting to form identity. So identity is very important in
Yes.
Nitram
Yes.
line.
Yeah. Yeah. Perfect. So again, this was my understanding. So looking at all the symptoms and then also trying to understand her from a mineral kingdom aspect, because she did seem to me like a mineral kingdom person. When we study the kingdom classification, when you will be joining to learn more about all these, you will understand that all the remedies are sub-classified into either mineral, plant, or animal. So mineral language is something which the patient, when they talk about themselves, we can see the mineral language, which, as in something is lacking in me, there is some shortcoming in me. So that was the kind of language the patient was speaking. So even I then prescribed Natrum, and to my surprise, because in vasculitis, I mean vasculitis again is a very, we don't get very often such cases. And Natrum, because one thinks of all the snake, the vipera, and the hammermillis, and all these remedies when we talk about any inflammatory condition of the blood vessels. Natramur is something new and very interesting it was. So I gave her Natramur. I started with 200, and to my surprise, within a month she was almost better by 40%. So earlier she could not even hang her arm, just for a minute even. She had to keep her arm close to her chest always, so that she could let her arm just hang for a while, and then the swelling had come down, the numbness had come down. So I continued Natrum for another month or so, and then there was further improvement. So this was last year. So then she went back to Pune. And again, now she has come. I mean, she was under my treatment. I repeated Natrum 1M after I think 3 months time period. So there was a sustained improvement. Also, earlier her emotional state also was much better. So earlier, she had this whole regret. She wanted to go into this modeling thing and all that. She's very fond of dressing up and kind of glamour and all. She is very attracted towards. So she said, I was very keen on all this in my college days. I even tried one or two ramp walks or whatever, but then my father discouraged me that this has no future. I mean, this is not for you. So I had to let go of that. But this desire, I was also continuing in my son. The son is a very cute looking boy, a young boy. He's 10 now. So she was very much attracted to the idea that he can go into this glamour world. So right from his young 5-6 years of age, she began to take him around all the shows, the kids shows and talent hunt and whatnot. So she said, "मुझे बहुत मन था कि my son should be in this field." I said, why do you think so? She said, because of the money and the fame, the identity, कि आपकी अपनी कुछ identity बन जाती है. So somewhere I could see that she was projecting her thing on her son. So she said, but then when this episode with the what's that Sushant Singh Rajput happened. So that was a kind of a jhatka for her, and then she realized that people like us don't have any backup in the industry, so it is not the right place. And then she left this whole idea about son, pushing her son into this. So the husband did say that we had lot of arguments about this, because husband was not at all keen, ye sab nahi karna, and she was very eager. So now with this treatment and physically getting better, at emotional level also, she could see that a sense of calmness. She was not too much uh, thinking about all this stuff. So I'm sorry, please don't overwrite, whoever is that.
Strange. Dr. Deshpande, can I ask a question?
Yes, please.
Thank you very much for this talk. It's fascinating. The vipera is so well indicated. You know, it has the blood vessels, the inflammation of the veins, the paralysis, the difficulty of letting limbs hang down. Everything that all her symptoms, all her physical symptoms are so well captured in vipera. And then, of course, the mentals in the Nat Muir. I want to know if you think maybe it was, how do I explain, a good idea to give the vipera first, to maybe take the first layer off and then the Nat Muir, or do you think you didn't really need the vipera at all?
I did give vipera initially in 2018. I did give vipera 201 m, but since
I'm sorry, what I'm asking, do you think it was necessary? I wondered, like, should you just give Nat Muir instead?
Could be. See, again, that's a very tricky, and in the sense, it's difficult for me to say had vipera helped in removing the layer. Could be, maybe yes, but it's more of a pathologically related remedy. Vipera has a specific rubric, worse hanging limbs down. So I am not, till date, I cannot be very sure whether to what extent did vipera help her, because that time I did not know what else to do. I stuck with the pathological thing. So maybe, I mean, because generally we do use all these snake remedies for inflammatory vessels, and they really work very well. So I could not really continue with the vipera thing, because she discontinued coming to me in the middle, and she went for surgery and others. She was trying out different things. So it's difficult to say, but yes, maybe.
I wonder if you had to do it again, would you give both? It sounds so logical, such a good plan.
Yeah, it does. But maybe I could have, but because in the first instance I did not really get the desired result, in the sense 3-4 months of treatment and not much of change. So you tend to kind of start doubting yourself also. So that is where all these different new methodologies really come. They like life saviors, because I was trying to do what I knew in those times. So that was my limitation, maybe. But
may I add something here, Dr. Jaya?
About? Yeah, please.
Yeah. This is where our PEM method, this is why we are encouraging all of you to join basic course, because as you know, there are so many 3 kingdoms, and there are some corresponding drugs. Maybe vipera, as I told you in the beginning, like in some practice, Rustox will help whenever you give for a pain. But after a few days, again, patient will come back. So there is something corresponding drug we are missing. Patient may not be a plant kingdom, but it helps, because somewhere it has a correspondence with the other mineral or animal drug.
So maybe basically,
that is why the need for us to upgrade ourselves. See, if you know what other remedies from the other kingdom helps, then I think vipera was just superficial remedy, and somewhere the source, her vital force was somewhere else. The source was somewhere else. Thank you. Yeah.
So can I continue now? Any more questions?
Dr. Jaya, there was a question in the chat.
Yeah.
Did the patient have any GI complaints?
No.
Okay. And her problem started only after her father's loss?
Yeah, around 3 years after her father's loss.
Okay, these were the 2 questions. Thank you, ma'am.
So, can I continue now?
Yes, ma'am, please continue.
All right. So I hope, this was an interesting case to share with you people, so that, I was just trying to share my thing with the initial knowledge that we had, and now with the kingdom knowledge, how we could kind of arrive at a much more matching remedy, and then the patient also found a lot of relief. So currently she's under my treatment because she's much better. She's almost, I would say, around 50-60% better. So she's still here in Gurgaon. She's planning to go by end of this month. So she plans to continue the treatment because she is much better. She is able to do her daily chores to a large extent. Earlier, she could not even lift a glass of water. So now with this case, I would just try to explain about the kingdom classification. I'll just give a brief I'll just touch upon the entire kingdom classification, and specifically because I have this mineral case with me, I'll go with the mineral kingdom. So as we said, kingdom classification, we have these three kingdoms: minerals, plants, and animals. And coming to the mineral kingdom means the entire periodic table. So all the elements in this nature, they come under the periodic table, which all the we know, what have been discovered and all. So now in the mineral kingdom, the very basic theme, or the जो बोलते हैं ना उसका सबसे ज़्यादा main point क्या है, that is as if something is missing, something is lacking in me. So if that is fulfilled, then I am okay. It could be lack of stamina, like people say मुझसे तो होता ही नहीं है, मैं तो इतना भाग दौड़ कर ही सकती नहीं हूँ. So this language talks about something lacking in yourself. So it could be lack of stamina, lack of support, lack of position, lack of confidence, lack of security, or lack of relation. So mineral features we have, it's basically when the mineral language is spoken by the patient, it talks about the structure, the role, the relationship, performance, attack, and defense. So in mineral kingdom, attack and defense actually means that they need to somehow preserve their structure. Whereas in animal kingdom, this attack and defense, we know about all the predators and the prey and all. So in that domain, in the animal domain, it is more about survival. The predator will attack and the prey has to run for survival. In the mineral kingdom, the attack and defense is more about trying to save my structure. So in minerals, the deepest core is emptiness. Some part is missing, lack of something, lack of structure or function, and I don't have it within me, or I am losing it. So if we, once you start attending the proper courses on mineral kingdom and all, you will understand that the entire periodic table, the left hand side remedies and the right. So how it goes from I am lacking something to I can develop and I am developing now to, again, I'm losing it. I did have, but then again, I'm on the verge of losing it, or I have lost it. So this is how the entire, mineral kingdom is understood. So when we see the periodic table, we can understand the mineral kingdom through the rows and columns. So we see the periodic table, you all know that there are these 7 rows and 18 columns. So homeopathically, we have kind of slightly altered the chemistry wala periodic table. Now because my case is of natrum mure, natrum belongs to the 3rd row. Okay, natrum is our regular, the sodium. So we'll try to, today we'll just try to understand the 3rd row. If because time is limited and I can't start from the 1st row and go on till the last. So I'll just take up the 3rd row. Just before that, I'll just give a brief this thing. What are the issues? So basically, if to make you understand in very simplest possible form, rows is the issue that the patient is facing. Rows will depict whatever issue you are facing, and the columns will depict how you cope with that particular issue. So I'll just try to explain this to you. So when we talk about the 1st row, which is the hydrogen row, the main issue is about existence and conception. Do I exist? Am I, in the universe, I have come into existence. So there is this whole question mark about the existence issue. The 2nd row, the lithium row, is all about separation. So lithium row is something we call as the womb row. So it's all about the birthing process. And the 3rd row is the natrum row, which is more about identity. The 4th row is the calcium row, which is about security and task. The 5th row is the strontium row, which is about creativity and performance. And the 6th row, barium row, is about responsibility. And the 7th, radium, is about disintegration and death. So these are all the nuclear elements and stuff, the highly reactive ones. So we'll talk about Natrum series today. So the main theme for Natrum series is nourishment, identity, individuality, ego, insult, choice, self, others, dependence, and care and welfare. So even if you go back to this case, we see there's a lot of issue regarding, my identity and also about dependence on the family as such. So Natrum always has this thing, I am separate, because lithium, the second row is over. The birthing has happened, the child has taken birth. So now third row starts, which is like starts from Natrum. So Natrum is like, now I am separate, but what is my identity? Who am I, sort of a thing? Because they feel that I don't have an identity of myself. It's only I am related to somebody like, mother or father. Whereas the next element, alumina, after natrum, is a bit of confusion. Who am I? What am I? Am I him or am I myself? Again, coming to the third, the silica is more about fixed identity. We all know silica, like glass. It is a very fixed identity. This is how people should see me as. So I'm just going in the same third row, the natrum line. I'm going remedy by remedy. So we had natrum, alumina, then we had silica. Then we come to phosphorus, which is like my identity is not with you as a family, but more with friends. So that is why we know phosphorus and the whole huge desire to be with friends and have so many friends. Sulfur again is, again the ego. It's more about the now identity part is taken care of. Now develops the ego, like I am better than you. So the huge ego issue with the sulfur. Then we have chlorine. So chlorine is I am exactly the opposite of you. So that is why when we study the most common natrum remedy, natrum mure, mure is nothing but chlorine. So there's a lot of different polarities that we see in that. That's why natrum is quite an interesting remedy, because it can throw up exact polar kind of symptoms also because of the mure element. So natrum mure has this crisis of identity, because one part, the salt is composed of natrum and chlorine. So natrum is I don't know, I only have my identity with regard to the other person, like I am their daughter, I am their son. Whereas chlorine wants to be exact opposite of the mother. So that is why natrum mure has this identity crisis. So that's what it has to do with what Carl Jung called the process of individuation. So this is the first distinction between self and the world. That that boundary where one starts to realize that I am a separate individual from the world. So this, when we talk about developmental stage, it is like up to like a child up to 6 years of age. They are not very sure of their identity. He's trying to assert his individuality. He says I am separate, but then he doesn't know who he is exactly. So sodium line, again, it is to do with parenting and also developing ego. So, if you talk about a child up to 6 years of age, what are the issues he's trying to master? So it could be something like, asserting my choice or trying to develop my choice. Like which dress to wear for a party. Now the child will tell, no, I won't wear this. I want this particular dress. Or trying to comb on his own. Generally, the kids are, the mothers, they groom their kids, they kind of comb their hair and all. Now this kid is trying to assert himself, and I will comb my hair myself. So some sort of stubbornness starts to appear. So in natrum and magnesium, the choice is not developed and he depends on his parents or partners. Alumina, there's this big confusion, this indecisiveness. Should I do this or should I do that? Phosphorus, chlorine and sulfur, because they are on the right hand side of the periodic table, they have a much developed identity. As the element progresses from left hand side to right hand side, they begin to whatever was lacking on the left hand side, they are trying to gain it one column by the next column. So that is why when you come to the right side, phosphorus, chlorine and sulfur, they are very clear of their choice, and they will also get their way. So that is what is the right side remedies. So doing things by himself, like combing his hair, I give this example. He wants to do the basic things himself, and is developing the ability to take care of himself and of his basic needs. Again, it is about care and nourishment. a childlike dependence for care and nourishment, where the need has to be understood and not to be stated. So, this is a very significant line, because even this patient, though she is so grown up, the husband said that, matlab, even in Pune, even if she has a mild fever, first thing she has to do is call her brothers. So the husband is like, why call them? Just take a paracetamol. So she's like, nahi, in our family, we do it this way. So she said, even till college, if I had any problem, some mild tummy ache or a headache, all I had to do was to just go and lie on my brother's lap, and then I'm totally all right after that. So I may not even need medication. So imagine, she's in this zone where her brothers know her needs very well, so she doesn't has to demand it. It is like, they are there to do it for her. So that is the kind of dependence for nourishment and care. Nourishment in this instance, it's more about the care aspect. I hope I'm being clear. So a relationship where there is understanding, familiarity, comfort, communication, confidence, trust, and attachment. So all this we could see in this particular case, how the entire need to be with the maternal side and the brothers, even though father is no more, but brothers give me the fatherly love. So she is very much in need of this, and it keeps her better. There is an implicit trust or a need for someone whom he can trust, understanding one's need without asking for it. I trusted him completely. So that is why when we see this, the very basic idea of natrum, maybe when we were in college about some breakup or something, and somebody has left you in a relationship. So it was more of a, without the other partner, I am lacking something. So I trusted him completely. So it is not, suppose there's a, some love story gone bad, somebody has left somebody. The mineral language is, we could see it in this way. There's a plant person, there's an animal person, and there's a mineral person. So mineral will react in a manner that without the other person, I am lacking something. I can't stand by myself. So this is what we talk about, lack of structure. Whereas a plant would be like, they will react. Plant is all about action and reaction. So there is some thing happening, you immediately react. So you may, have a sinking heart, or you may have some palpitation, or you may faint. That is the plant sensitivity. Whereas an animal would be, how dare he do this to me? I will take my revenge. I will not leave the person. So this is the language we are talking about. How in a given situation, the three kingdoms speak three different languages. Okay. So again, about self-respect and ego, it is a part of development of I. So when you try to do these PEM courses and all, you will understand the whole idea of ego and I and ego and superego and individuation and all that. So this is again, see, I think I need to give time to the other speakers also. I will just skip this because this is generally more about the natrum line. Is that okay?
Yeah. Because
So,
anyhow,
know.
in the course, all these things
everything
will be
taken
covered.
care of. So it is
Yeah.
again in detail about the natrum line as such. So again, I have again told about this natrum mute. That's
But
why,
Dr. Jaya, I have a question for
yes,
you.
please.
We understood your case and this. What difference was there, before joining, before upgrading yourself about Natramure? And once you know all these columns and Ian Skolton's teaching, how much you recommend people that why they should upgrade? Because with the Natramure, what is your thought about courses and upgrading ourselves?
Yeah. I would say without all this knowledge, I was like lost. It was more of a trial and error thing maybe earlier, because repertorization throws up a lot of remedies. Now you don't know which one to choose. So it is, more like, and everybody knows we can't totally rely on the repertorization, because it really sometimes can be misleading. So once we have this whole knowledge about the knowledge of kingdoms and all these methodologies, it's so easy. It's like it becomes more logical once you try to, when you take a case, you understand the patient and you get a gist of, most probably the patient is talking in mineral language or plant or animal. So then suppose you, in the repertory chart, you have some 20 remedies. If you are sure that this patient looks like a mineral, so it's so easy. You just eliminate all other non-mineral remedies, and then you come to only the mineral remedies. And again, if you have a very good understanding of the rows and columns, so you can easily, spot on. You can say this, like one doctor told me, na, about the remedy. This looks like an identity issue, nourishment, so natrum line. So that's how, you just hit the right thing, and then it's very easy for you, because every element, its place in the table. So you know which column and what is this patient. We can fit the patient in the right column and row, and it's like bang on, you get the right remedy. So
So,
definitely,
so you mean to say you recommend people to
I,
learn new things, don't
I think
stick to what we know and very happy in our
I think
own
this should be
space?
taught. My feeling is this, all this should be taught in the college level itself, because otherwise, like us, we were not that we were lacking in effort. We were doing our best. We were running clinics. We were seeing patients, but not happy with the results, because we knew something is missing in us. We were in the mineral zone. Something is missing. I need to fill that gap, and that's where all this knowledge came in handy. So
Or
it is.
somewhere you become animal and went, वो क्या है देखेंगे सीख के
नहीं,
आएंगे.
animal होता तो, like, forget, to hell with this, I'm going away. So, definitely it makes a huge difference to your practice, because things become so much easier when you can simply eliminate, you can kind of just put the patient in the right slot. So it's not that, it is again something easy, but once you have a thorough understanding, then it is very, very beautifully used in practice, and you really enjoy your practice.
Yeah, that is what nowadays we are taking less vacations, right?
Exactly.
Yeah.
We can
Thank you,
learn.
Dr. Jaya. Thank you so
Excuse me,
much.
madam.
Yeah.
Can I have a question, please?
Yes, please.
Dr.
Madam,
Jaya,
I'm
you
Dr.
can stop
Padmaja.
sharing
Okay.
so that they can see you.
Yeah. Yes.
Yeah, I'm Dr. Padmaja, madam, from Hyderabad.
Hi.
So, madam, I have one question. Like in the first repertory chart, you did not take the ailments from, or the father loss aspect, the mental ailment, कुछ भी नहीं उसमें add नहीं किया है ना. अगर add किया होता तो उसमें भी नेत्रम आता होगा. Then the second thing, madam, no, one thing, madam. The second question is, I recently finished FCAH and I have an idea of PEM also. So what I mean to ask is, when you said that that girl is very good with the care, just अपने भाई के lap में सो गए, it's good. Then that indicates that it's a total dependence, and it is first column of third row. So according to Shankaran but this one also, a third row first column is in हमको पता चल रहा है. लेकिन what I mean to ask is, according to PEM, will it be different or will it be the same? Because PEM में अगर PEM नहीं हो तो भी चलेगा ना. Shankaran's understanding is also enough for that, right? So what is the upgradation if we know PEM also in this one? And the other question is, what is the natrum part? तो समझ में आ गई. So what is the chlorine part in that one? Because and in the first place, when you have given Vipera, that is also true to the pathological extent. But in general, vasculitis, अगर हम GNM से लेने पर भी vasculitis or fibromyalgia, they indicate that loss of love or daily course करने में उनका तकलीफ. Vasculitis means circulation is being disturbed. The circulating blood will be disturbed. That means daily circulation, daily का काम कुछ करना उसको बंद हो रहा है. That is what about GNM. So ऐसे लेने पर भी हम वाइपरा से अलग हम उसको कुछ और साइकोलॉजिकल मेडिसिन लाइक नाइट्रम और कुछ और के बारे में भी सोच सकते थे, ऐसा ना?
Yes.
And before Dr. Jaya, because you have done some course, you can really,
no,
correlate.
madam, what I mean to ask is, my question is, Shankaran's understanding is enough for this case, na? So what is PEM especially tells in this one? That means if we need to, is there a need for us to upgrade to PEM also? That is what is my query, madam. Thank you.
Yeah. So I got your question. See, the thing was, back in 2018, PEM was not there. I mean, sir was still working on it. So my understanding was limited to FCH thing and the Shankaran sir's methodology. So Vipera initially, in the first repertory, natrum is coming in a later It's coming maybe around 11th or 12th remedy. That time in the first case taking, she did mention about father's loss, but this whole thing about, this much of attachment to the father, and the whole thing about her wanting to join the modeling and all this came up in my second case taking. That is why the first repertory chart was not very complete, that I admit. But the natrum is coming up in that also, but it was coming way behind. Initial were the sulfur, phosphorus, and all those remedies. So because they were all polygressed, and I was not very sure which one, because most were the mineral kingdom, sulfur, phosphorus. So that is why maybe I just went with the pathological angle, and it gave a very partial relief. So then the second time she came back to me, I did the retake, and then that was where I could really the whole grief aspect, the father loss thing came up very, very, very prominently. She kept spoke to me in detail about the whole thing. This is what happens. That is why we need first case taking. Not every time we are able to get the case in entirety. I think all of us agree. It's not zaruri nahi hai every time in the first case taking that we end up with a very complete case. There are many things which we miss out. So this was why I have taken up this case to explain, all these gaps, all these shortcomings, and then, once post after 2 years, how the case was taken, and again repertorization was done, and also from the understanding of the kingdom that natrum, only if the repertory chart showed natrum, I would not have been too confident, because natrum generally one doesn't think of in vasculitis cases, in any inflammatory blood vessels thing. But because I could see the patient from this angle, the mineral point of view, so I was then very clear that natrum is, she belongs to natrum line as such. And again, the third part,
excuse me, madam, abhi bhi wo modeling or attracting of glamour.
No. I told na, she was projecting all this on her son, but then with this whole, when did this thing happen, Sushant Singh? I think it's been what, 2 years?
No, sir. That comes attracting glamour, everything that comes that can be suited with natrum mur, madam. Natrum mur में आ गया वो सभी glamour का path, वो सभी.
Glamour specifically नहीं आता, but this was more about trying to carve an identity. See, if you try to see her childhood, she was a very protected and pampered child. So when she came to college, she began to assert her thing. So maybe she was attracted to the glamour part because she wanted to carve an identity, and this was the field somehow she could relate to, because she was good looking and all that. Now you get it. So that is how we have to, have a very broad mind to understand the patient, because it's not that the patient will give us in like mineral language A to Z, everything is like perfect. We have to really have that open-mindedness to see with the patient's body language, the hand gestures, all this will be
and in same case everything cannot be applied, right?
Exactly.
As she was asking, sensation method, PEM, each case is different. Sometimes keynote also is helpful.
Exactly.
So you cannot see in each case everything. It depends case to case.
And as to your question, why PM is important, see, suppose in this case natrum was not helping the patient, so with our PM understanding, maybe we could think of analogous remedies. So if we have natrum mur as a remedy, and we think it could be the remedy for the patient, but you can always see the analogous from the plant, from the animal, what are the analogous remedies to natrum mur. So that is where the stages of development, the PM, that is really comes very handy. So, it is not, these are not exclusive that I can only understand from if the sensation methodology, I'm done. See, in our field, ours so is like a Mariana Trench, deep, jitna bhi deep jao, khatam hi nahi hai. So we can see so many different ways of arriving at this millennium. Na? So any of these and a combination of these, it depends from case to case, what might help you.
Yeah. Thank you, Dr. Jaya.
Yeah, all right.
Thank you so much. It was a wonderful case. And I think you have inspired so many, fellow colleagues to upgrade themselves.
I do wish.
We all wish you all learn through basic course, join. And thank you. Thank you, Dr. Jaya. Yeah. Now, Dr. Hetal, I request Dr. Hetal. Now, all question answer, no, if possible, we will take at the end. Otherwise, we will discuss all these things in our group.
Just before starting, ma'am, I would like to tell everybody, please do not scribble on screen as it causes distraction to the speakers and the fellow participants. And we will be addressing the questions at the end of the session. Thank you.
Or in our groups, we have no music groups, we can discuss later. Dr. Hetal?
Yes, yes.
Yeah, thank you.
Hello. Is my screen visible?
Yeah, very
Yes,
much.
Okay. Just a second. Yes. Okay. So thank you to Team Healing Harmony for giving me this opportunity to share my clinical experience. And I highly recommend you all to join the course.
Dr. Hetal, please, sorry to interrupt. Can you make it full screen presentation?
Yeah. Yeah, how to?
Go to slideshow and start from beginning. There is one slideshow option, no? Up.
On the bottom where you can see the no, next to that.
Bajuka. Next,
Oh,
next.
next one.
Next.
Yes,
Slideshow.
yes, slideshow.
Okay.
Yeah,
Yeah,
thank you so
thanks.
much.
Yes. So, okay. In my practice, the sensation method and then this PM method has helped me a lot. A lot. I can't tell you how much it has helped me, and I'm still learning. I've joined FHPC to learn it thoroughly, and I highly recommend all to learn these methods. Yake's plan chart, Jan Scholten's mineral, and Dr. Sankaran's this new method, WISE process. That is also very helpful in my clinic. So not taking much of the time, I will start with the case. So this is the case of a 17 years old boy who came for the consultation with his mother with acute rhinitis. So generally when patients come, we observe. So this was my observation during the whole consultation. Yeah. So he was a very shy fellow, not talking much. All the history was given by the mother. He was by build, physical build-up was tall, dark, and having some acne on face. He had oily skin. He had to constantly wipe his nose due to cold during the interview. And he was smiling and looking down when I was taking his case. So most of the case was given by the mother. Yeah. Next. So this is the verbatim. So yeah, questions Q is asked by questions asked by me. Okay. So tell me about your complaints. The patient says it's only this cold nose block. My nose gets blocked and jammed. When is it more? At night and in the morning, when I go to bed, there is watery discharge. Mother says sometimes he also gets breathless. Yesterday he had orange flavored Glucon-D and he got breathless in the morning, but mostly he is less problem during this hour. Like he came at 12 noon for the consultation. So during the day, he is having less complaints. At night, his complaints and rhinitis aggravates. Okay, so, and he was asking for some medicine to stop that discharge, as he had to use nearly 7-8 handkerchiefs to wipe that watery discharge. So what problems do you have? Just that the coryza and continuous running nose and sore throat. My nose feels jammed, filled up. The discharge is transparent and thin. He also had a little bleeding this time. Mother says he also had a little bleeding this time. So he sneezes in the morning and he has predominantly it is left-sided. So left-sided nose gets blocked. Any history of asthma? I asked him. Till the age of 14 years, he was only on homeopathy. The mother is telling that, the mother is my friend, and she was telling that initially, since the childhood, he was only on the homeopathy. But once the allergy got so severe that he had to be admitted into the hospital. And that's why they, stopped homeopathy and altogether switched for allopathy. So this patient, when he was 17 years old, he came to me. Then first time he was coming to me. Yeah. So he is having continuous cold since last 2-3 years. And if it becomes extreme, then he becomes breathless. If he has physical exertion like playing football on turf, then he will have more cold and breathlessness and he will have to take the inhaler. Otherwise, he is fresh, but he has this constant cold and stuffy nose since last 2-3 years. He doesn't complain about it and tells that he is fresh. We feel uneasy or has a headache, but he doesn't tell anything. Just that there is continuous discharge from nose. Yeah. Any other complaints? And what happens during breathlessness? So patient says, obviously, he cannot breathe and problem in inhalation, can't take the breath in. And mother, sometimes he complains of backache if there is cough. So then I go for the nature. Yeah. So mother is telling, I ask him, is he a quiet fellow and shy? So mother says, no, he is not quiet with his friends. Specifically with his friends, he opens up. That's what I feel. He is calm, doesn't make much fuss. At home, he is calm by nature. He is very adjusting. He is very understanding in all manners. Suppose there is a situation in the house when then he will handle it very maturely. He has 2-3 younger siblings, and when they fight, he sorts out the fight between them without taking anybody's side. And he's a kind fellow. So, and then the mother says he's very lazy. He will not manage his things. He is good at operating mobile and with his friends. He likes to, his most of the times his teenagers are nowadays on mobile. So it is some obvious thing. Yeah, but he's good at studies. More about what makes him angry. So the patient says, now the patient starts speaking because it's an issue which is bothering him. So he's telling that I don't like to, when I'm forced to do some things, when I have to do something which I don't want to do, suppose I want my mobile phone and I am denied, or I want to watch TV and I am denied, then I feel very angry. If someone tells something offensive to my friend, then I feel angry. I feel for my friends. If somebody tells something bad to my friends, then I go and confront them. See, during this whole interview, the patient is silent. Even his physical complaints are described by the mother. If you observe, I'm telling in between my observation. When the patient responds spontaneously, that must be very important for the patient, So when he starts speaking, we should really notice where his sensitivities are. So here, if we see, he doesn't like to be forced. That is one thing. Then the second thing is he's sensitive to being offended. If someone offends his friends, he takes a stand for that friend. Yeah, so friends are important for him. Next question, why do you go instead of him? So I ask him, why not let your friend confront, and why do you do it? So he's telling that because they get scared and you don't get scared. So patient says no. Then I go further. Any dreams? He says no, very rarely. Any fears? No. Mother says he's only scared a little of his father, but not actually fear, out of respect. He's not scared of anyone. He can silence even his grandmother, who is very loud in behavior. So then I ask for pregnancy history, and mother says that it was totally normal and very happy pregnancy. She enjoyed the pregnancy and no nausea, no other complaints, but just that the mother had craving for cocktails. The cocktail here is a milkshake, a thick shake with ice cream. The place where we live, it is called, it is a non-alcoholic drink, which is called cocktail here. And lemon soda. The mother craved lemon soda also. I don't know whether that has affected him. So mother tells, maybe I had every day, during the pregnancy, literally every day she used to have this milkshake and lemon sodas. So that might have affected him. He doesn't eat ice cream, but he loves soda and soft drinks. Any food desires? So mother says outside food. Generally teenagers love that, no? So mother again says he likes home cooked food. So this is not important, let's skip this. Then hobbies. So patient says, again, patient starts talking. I like to play outdoors and being with friends. I like to go out with friends and eat outside or play PS4, which is a video game. With them at home or watch movies. I like English or Hindi thrillers, autobiographies, and drama. I watch movies to time pass. So if we again pay attention what his sensitivities are, the whole thing is revolving around him and his friends. He likes to be with his friends, go play outdoor games like football with his friends, and he likes to watch Hindi thriller movies, autobiographies, and drama. So I asked, any sore throats? Yes, pain while swallowing and feel something is in the throat. Ambition, nothing fixed, just be in routine. Any restlessness while studying? So mother says, yes, he is very restless. He cannot sit at a place for more than 15 to 20 minutes. And he keeps changing the rooms also. He would sit in the kitchen, in the drawing room, in the study room. So he will keep changing. Yeah, so that much is important. And, then how was his interaction with other kids? I asked when he was young. So mother says he would mingle only with people he would like. Now it's better. He is having more friends now. He was not very introvert like he looks. Mother is, clearing out my doubts that he is not an introvert as he looks at face value. He did have a few friends in our family. Also, people tell that he doesn't speak much. So all the people who know him superficially may be telling that he is quiet and doesn't speak much. But the mother says he is not so. Like, he does have emotions. He does have friends. So patient says, specifically, now patient again speaks, I talk where I feel like. So he's very choosy, which kind of people he wants to interact with. Why don't you speak? I asked him. It's like that since the beginning, no specific reason. It's like that. I'm like that only. Main aisa hi hu. So mother, we cannot say he's shy. He likes his cell phone a lot. So maybe on the social media, he's very active. So he is better by rest overall. So mother is again telling that when he has this acute rhinitis and coryza, he is better by rest. And if he exerts himself physically, then again he has this problem escalating. So I ask him, how is your decision making? And do you get confused or you can decide quickly? So patient says, I am indecisive in all things. It takes some time to make up my mind. For an example, if I want to go out, I will think for about 15 minutes whether to go or not. Then I decide. So this is also very significant. I noted it 3 marks, whether he wants to go out or not, 15 minutes to decide that. So mother is very understanding. He's very adjusting. He doesn't have fixed criteria for anything. So he's very flexible and understanding fellow, and he's not stubborn, mother says. He won't reply quickly, but he won't reply quickly. If somebody asks him something, he will keep quiet or ignore answering the questions. Yeah. So patient says again, I don't like repeated questions. He was kind of irritated that maybe I felt that at that point of time, I felt maybe I'm asking him too many questions. So he says, I don't like repeated questions. In which matters do you feel confused? Not for choosing clothes. When I have to select a place for visiting or outing for career, also I am very confused. So two things he is more confused with, whether to go out or not and which career to select. So when he came to me, he was in 10th standard or maybe 11th. So do you feel weak after speaking? No. So I had, by this time, I already had one medicine remedy in my mind. That's why some of the specific questions will come. So that we are not allowed to ask direct questions, but this was the mistake I made in case taking. So mother, he gets fever after physical exertion, like after night outs or playing. What do you do when you get angry? He would shout. Mother says he would shout. Do you keep things in mind? No. Any aggravation time? So I was in general asking whether he thinks too much about the hurts, or does he keep grudges in mind? So the patient says no. Any aggravation time for his complaints? Mother says at 4 or 5 a.m. in the morning, early morning, he has aggravations and he gets up to drink water. Yeah, so he is very understanding, sharing again and again this is coming, and he's very lazy, won't even cut his nails. So mother has to constantly be after his back to cut nails also. When I take away his mobile phone, he gets very angry. Even the patient said this, if you remember what makes him angry. He can do settlements very easily. He can sort out the fights between two people, younger kids, very easily. Thermals need fan, but AC aggravates. Narrow places, yes, a little bit. Again, the patient is speaking, yeah. A little bit breathing problem from that. Is he messy? I ask. Mother, completely messy. He would spill things when taking food, when he wants to, he's taking food from a bowl, he would spill the dal or anything. So, stubborn, mother, not much. Do you keep things in mind for longer time? Again, I ask. So patient says for 1 or 2 days, not much. Mother, he likes buying fancy things, but he hardly uses it. So he likes for the sake of having it, not actually for the using it. Maybe a show off thing of teenage, So are you good in maths? Patient says yes. Mother, he would sell question papers. Now this thing is again coming as a surprise from the mother. So as I was digging very hard to know about the patient's nature, the mother maybe must have thought here she must give some secrets. So mother is revealing his secret that he would sell question papers and get money for that, then sell it again, use it as pocket money, use that money as pocket money, and not pocket money, but he would do that kind of planning, strategizing, and that kind of things. So I asked, like what? So patient says, suppose I have to complete my journals, then I would give it to my friends to complete them. I get question papers 2-3 days prior to exams, then I would sell them to others, and by that I get sufficient amount of money to play on turf, to play football. Why won't you complete the journals? I asked. Patient said, I don't have time. Mother is very lazy. Don't you feel scared of getting caught for leaking question papers? Patient says no. How do you get these question papers? So some peon helps to get him. Yeah, and mother tells he falls down and breaks his bones frequently. So now that part goes away. Again, new thing comes up, that he's very awkward while walking and he gets fractures many a times. And he likes some comedy TV show, sports and football. Then I ask the mother, does he smile less or so? The mother says no. Does he startle from sleep? Mother says no. Is he non-observant? absent-minded in his own world? Mother says yes. His observation is poor. And any aversion to girls? Mother says no. So maybe he's having some girlfriends and mother knows that. Any mood changes or cheerful in the evening? Mother says no. So these all were the direct questioning, and I had already decided pre-handedly, like before listening to the patient, that this is the remedy I'm going to give for this acute rhinitis. Yeah. So any guesses about?
Dr. Hetal, before that,
Yeah.
can you tell me how much your case taking ability improved before attending
A
all these?
lot. And now, previously, what I used to do, as soon as the patient will start telling the symptoms, simultaneously I will repertorize the case. So half of the attention is gone there, and you already get preconceived ideas about things, that this is the remedy, this is the remedy. But once as Dr. Honeyman said, that you have to see what needs to be treated in a case first without judging. You have to become, non-judgmental while case receiving. So that has improved a lot, I would say. I was a thorough repertory person. I would repertorize each and every symptom, even the minute ones, and I had beautiful rubrics to come up with. And even many cases got solved with it, but there were a lot of failures. And these failures pushed me towards learning new things, because repertory is what it is, just like mathematics. You add up symptoms, you see which one is majorly coming, even if not first, in first 10 or 15 remedies, which one is coming up strongly. And then you decide, whether it is covered by that or this or this. Now, totally, I don't see a single rubric. I, resist that urge to repertorize the case nowadays.
But some cases still require, I believe, no? Some cases which are very...
No, I do
Yeah.
repertorize, but at
Yeah.
the end of the case.
Yeah. Thank you. Thank you.
Not
Sorry,
in-
you were asking for remedy guesses.
Yeah.
People have anybody can guess.
Yeah, please.
Dr. Hetal, someone has messaged sulfur on the chat box.
Okay.
There was one question. Did he check his vitamin D? Is the question.
No. Yeah, so can we go forward? If anybody wants to suggest, then we can wait.
Dr. Namita is saying lycopodium. Dr. Vidya is saying Naxvamika. Padmaja Rao is saying reptile remedy.
Yeah. Okay. Good suggestions. Huh? Yeah, so due to time constraint, we'll go forward. So looking at her acuteness and the profuse watery discharge, the time during aggravation time, like 4 to 5 a.m., I repertorized it very nicely, and amon card came up, if you see left-sided obstruction and everything. Yeah. But generally, I take follow-up in acute complaints. The very next day, I ask them how they are, and he said there is absolutely no effect of this medicine. So then what options left with us? So we have to reconsider the case, what was missed out. And this repertory method is like zooming into the things, zooming into things like seeing the minute details, the time of the aggravation, the side of the body affected, and then causations and like causative factors, and these all things, but when we actually zoom out, what was lacking in this case was there was no mind-body connection. I totally, bypassed the mind features. He was telling me that he is fond of his friends, going out, playing with his friends. He was telling he was indecisive regarding selecting his career or whether to go out or not go out. He was telling me that he fights and he takes a stand for his friend, and most importantly, the mother revealed his secret that he did some, question paper sailing. Before the exam, he used to sail the question papers. So why a person would do this kind of things, these thoughts you should take at the overall picture before deciding a medicine. And so again, I reviewed the case as I have already told you, but I think the time is running out. That's why I will go further. We won't go back to the slides, but then wait. So the key is observation. What we need to observe that he was a shy person, tall, dark fellow. He had pimples, acne on his face. He had oily skin, and he was not very much open, Then we also have to consider the mind picture along with the physical symptoms. If this both match, then the magic of homeopathy happens. Then, okay. The remedy should cover, yeah, that's what we said. Here first I had gone into details. So now I had zoomed in, and now I need to zoom out of the case and see what are the main things. As we discussed, now what are the main things? So in this, we have to be very mindful about what needs to be treated in any case. Like, what is the center of the case? Yes, anyone can suggest? Anyone can suggest the mind symptoms?
Friends very important to him.
Yeah. So that means what? What do you translate it into according to PEM language?
No, I'm not getting that.
Friends are important in which age development friends are important for us?
Adolescence.
Yeah, true. So this remedy must have some features of adolescence. Yeah. Then
So maybe row 3.
maybe row 3, yes, but row 3 is not. It is before adolescence, infancy and toddler stage. Natrum development, yeah, that is also true.
Yeah, thinking of phosphorus, yeah.
Yeah, phosphorus kind, yes, true. Then we ask further questions, now in our mind also. Is he phosphorus like? Will a phosphorus do this kind of things?
No.
What other things he is doing?
The exam paper thing doesn't fit into.
Yeah, so exam paper thing will fit where? You have to think.
He has a big ego. He's lazy.
Yeah.
So those things.
Yes, very true.
Skin problems. So
yeah, he's having acne, which is again a teenage. In adolescence, it's common to have acne, and a lot of it. He had a lot of it, but he didn't complain. Yeah, so he was not very natrum line fellow who would complain that I have this acne and treat me for this. He had only come for this rhinitis problem. Yeah, so any more suggestions for the mind picture?
Initially, he is very shy, and afterwards he came into discussion. This tells us about the reptile character also, and he is very angry, and the section when he has taken the mobile from him. And the other thing is deceitful with the question paper issue. Everything may suggest a reptile, and that too, that question paper issue, the money is for him. It's not for others, and he is settling his friends' issues also. That means he is on the upper hand. So it could be a black mamba, or it could be a simple lacasis also. Something like reptile, I think.
Yes, very true.
and the other thing is it seems animal kingdom matches with him because he's very concerned about his relationship with others, and I don't know, it's me against you sort of thing, not in an aggressive way, but this
in a shy way, yes.
Yeah, in a well, I don't even know if he's shy so much as he's lazy, and
It's just
he knows what
undercover. Yeah. He's just not exhibiting his true
Exactly.
colors in front of
Yeah.
me. Yeah, he's not shy. The mother repeated it for dozen of times that he's
Yeah.
not shy. He's not shy. Yeah. So yes, many of you are right. So this thing I translated it into, it is a reptile remedy, so this is a reptile. Because who would do this kind of thing, like antisocial thing, without any regrets, without any fear? Who would be so much good at planning and plotting things? Like, he would not write his journals also by himself. He would give it to others to complete it. And he would never do his work on his own, very lazy and very, withdrawn into his own world and doing his stuff. And also this requires a lot of skill, being a student, to bribe the peon and get the question papers just a night before the exams and then sell it to someone without getting caught. So he must have done it in every exam, even for 3-4 years. And mother, surprisingly, the mother is also not stopping him. Yeah, but that is not the thing. Yeah. So okay, so what other things we see? So what kind of reptile it must be? There are many reptile remedies. Na? Name a few. Anyone?
There are some suggestions in the chat box. One was Python and one was Black Mamba.
Yeah. And
Dr. Hetal, if
yes.
they don't answer 3, then they all need to join some course.
This has tremendously helped me. This PM method, I would really suggest you that in all my cases, it really helps me. I equally do like repertorization, but after understanding the case, this method brings the understanding of the patient, like what needs to be treated. Yeah, so we'll see. So then I limited my search of repertorization only for the reptiles. Then I selected some very broad rubrics like nose coryza discharge with fluent, nose coryza chronic, because he is having since childhood, very chronic. So these two remedies, like all amongst all reptiles, lecasis and elaps, these are very strong. Even Naja is coming. And Echistrodon piscivorus, Sancris, Heloderma. Yeah. So amongst these, mostly we will choose. Yeah. Then we can also go for detailed study, but why I choose one amongst this? So what do we see? Lecasis is left-sided. Yeah. Generally, all snakes have left side prominent. Then amongst that, lecasis was coming up very, very strongly. But I didn't give him lecasis. Yeah, why not? Because lecasis, yes.
Well, he doesn't. Lachesis talks and talks and talks, and he's not like this.
Yes,
I'm thinking.
very true, very true. Yes, right observation. So this must be a shy snake. So once we reach the kingdom, like animal kingdom, and in that reptiles, so into that, which one to select? So in reptile, we will select a reptile who has adolescence as inner age, like inner age of personal evolution model. So PM wise, he must be teenage. So that's why amongst this, and he's a very shy snake, some netrum quality you can see in him, like he's sensitive to hurt, and he's very moody, and he will open up with only people he wants to open up, So that is a natrum line feature. And Elapidae group of snakes come under natrum line, which is Naja, Elaps, and I think Bungarus. These all are into Elapidae group. So they have very strong natrum line features. And under that, Elaps comes under this adolescence. So that's why I gave him elapsed 200 potency, 1 dose, single dose, and his entire cold went away. Like with only 1 dose of elapse, and that was a miraculous cure. You know, you can you feel so good about it that it. Then again, after 1 month or 2 months, he came back, and the same remedy helped him in 200. And later on, I had also went for 1M. But now he doesn't come. Just in 6 months' time, all his allergic cold went away. Yeah, so it has been, I guess, 3 years that I have not seen him. In between, I had met him, but he is absolutely fine, no cold. And he used to have, 7, 8 handkerchiefs filled with that watery discharge, and that all stopped. And the mother had this peculiar craving of cold drinks. Cold drinks also was there. Then later on in one other follow-up, I had also confirmed whether he had this acidity and cold feeling going down the throat, while drinking the cold drink. So he confirmed it. So all the PQRS symptoms were also matching, and that was it. So
May I ask a question?
yeah. Yes.
Thank you so much. Really fascinating case. And I can see now, I look at Elapse, it has the egoistic and the kind of, well, haughtiness almost, he knows he's right. No need to, shout about it. But I don't see in Elapse the physical coryza. Maybe I need to read a little bit further. But what I'm wondering is you mentioned, and forgive me, I must have missed it earlier on when the first speaker spoke. What is PM stand for? PM method?
PM method is Dr. Mahesh Gandhi's personal evolution method. P stands for personal, E for evolution, and M for model. So in this method, we map the inner age of the person. Like suppose a patient can be 60 years old, but his inner age can be infancy or maybe a womb stage also. So accordingly that they will behave, and accordingly that they will have the symptoms even in pathology. If we see this person is having pathology, even in this case of mine, so this patient is having acute rhinitis and blockage of nose, and he is having this plug-like sensation in the throat. So everything matches, at the physical level also, at the mental level also, because it is only the two sides of the coin, your mind and body. They always, go hand in hand.
And in our basic course, we have 2 lecture on PM by Dr. Reni and Dr. Preeti and Prajakta. Wonderful lecture. I think you should listen. The basic concept of PM, they have explained very well.
Yes, true. I've been into one of the this series of Dr. Preeti and Dr. Prajakta. They are wonderful teachers. Yeah.
Would you say that this is a sort of part of the sensation method?
Sorry?
Do you feel that the PEM PE method is part of the sensation method? Same sort
not
of.
At all, not at all. In fact, it adds to the understanding of sensation method.
Yes, that's what I mean.
Yeah, if you see this, Dr. I'm sorry, in the previous case, that repertorization chart had come, and Natrum-Mur, and next remedy was Bryonia. So if we go according to PM understanding, this patient was having identity issues, natrum line issues. And Bryonia is also into natrum line of development. Bryonia is also falls into infancy line, like infancy and toddler line, Delinidae subclass. So they both are very similar. If we see the pathology also, the arthritis and all, Bryonia comes up very strongly for that. So if Natrum-Mur wouldn't have worked, we can see the corresponding remedy in plant kingdom as Bryonia. We all know Bryonia, no? But after the sensation method, we can actually understand what the inner age of the patient is and why is he having that sensation. So that is the beauty.
Thank you.
It is not something altogether different or difficult. It is not at all difficult. In fact, it makes the choice of the remedy very easy. Because elapse is not coming anywhere in repertorization. If we see that, Amon Carp's repertorization, if we see, there is no elapse. In fact, in animal remedies, sepia is coming up. And some this other drug is coming up. Sepia only with 6 symptoms. So how would we see from, if we only know the repertory, how will we know that we need to give elapse? Suppose the mother luckily told about this thing, otherwise I couldn't catch him, na? Otherwise, how would I catch a snake in the first consultation? It is always difficult to catch a reptile.
Yes, sure.
Yeah,
This was a very mind-blowing case for me.
So then I wanted to tell you that there are many methods in homeopathy. Like one is the old methods. So we learn all this new method not to, discard the old methods. In fact, it makes our understanding of the old methods very clear. It makes the prescription very, very strong and on a strong foundation. So the keynote practices for which you need good knowledge of materia medica. The repertorization, you need good knowledge of repertories and different kind of repertories. Some of the repertories you cannot use in every case. Every case needs a different kind of repertory. And these are the basics which we learned in college, but when we actually come into practice, we realize, like I realize strongly that this is not enough. And repertorization, in spite of trying very hard, if not very good, I may not be very good at it, but I really try very hard. Then to keynotes, knowledge of materia medica and repertory is not enough. I did face many failures. And then ultimately I went down into learning all these methods. And so, yeah, these are the good methods that I am learning, but there are many more. The sensation method of Dr. Rajan Sankaran, the synergy method of him only, and the PM method, the personal evolution model, which maps the inner age of the patient and makes it very easy for us to select. You can understand the human part of a remedy, that why the patient is telling such and such things. Why is he sensitive to certain things? And the mineral chart by Jan Schulten, the plant chart by Dr. Yakir, this new method, the wise method of Dr. Shankaran, and even many more are there. Now, polarity analysis of Dr. Heiner Fry, and many more are there. But right now I am learning this much, and I am doing my FHPC, and I am very glad I joined it.
Madam, excuse me. What about the mental symptoms of the deceitfulness and the responsibility? Are they improved, man? Did they improve?
It didn't come up. It didn't come. No deceitfulness was there. The patient was a backbencher, and he would do some small pranks on other students, but he was not very cunning fellow, or no planning, plotting, other than this fighting thing. He used to take a stand for his friend. Teenager kind of attitude, that if you hurt my friend, I will hurt you. That kind of thing, animal energy we saw, And then the other planning we saw into this, he leaks the question papers. If the mother would not have told me this, I would not have come to reptiles, to be honest. It's difficult, It's difficult. That's why. All the symptoms are denoting a Amon carp, if you see the chart. Yeah. So that was my today's presentations. Any more questions?
Just observation that elapse, actually, when you read further, it does have the stuffed up nose, the problems with the nose that he had.
Yeah.
So,
Yes.
Okay, fine, Amon carb was good, but elapse fits both mental, emotional,
Yes.
and physical.
Yes, true, very true. But there are hundreds of remedies which cover it. Now, which one to select? You do repertorization, taking a few symptoms, and then another symptoms if you select, another rubrics if you select, the whole chart changes. Which one to select? So to get that clarity, which kingdom and which what is the inner age of the patient, this PM method has helped me tremendously, I would say, and I really feel deep gratitude for my teachers, Dr. Rajan Sankaran and Dr. Mahesh Gandhi, for teaching me this. You know, it's a blessing to learn from these masters. It's really, it really is. I never miss a module of Dr. Mahesh Gandhi, never.
Thank you. It was so wonderful.
Thank you so much. Thank you. Yeah.
Yeah. Thank you. So you also agree that we need to upgrade. Otherwise, we are not in the race.
200%.
Not in the race of, helping human.
Yes,
kind.
yes. Actually, this is such a noble profession, and if we really want to help them, this brings about beautiful cures, beautiful ones.
Thank you, Dr. Hetal.
Thank you, sir.
Yeah.
Dr. Hetal, you'll have to stop sharing the screen.
Hello. Did I stop sharing
No,
my?
No.
You don't need to thank us. We need to thank you. Thank you so much. It was such a, wonderful
Yes,
presentation.
it was nice sharing my journey.
Yeah.
You already know me, madam.
Yeah.
How much questions I asked. Okay, so how to leave that? Can you please help me? I don't know.
You
On the
stop
top.
sharing option is there. You can press that.
Stop sharing.
On the top, it might be there. Stop share. It would be written.
Okay. No, I don't know how to do that. I'm so sorry. New share, it is showing new share.
No, next to that, there would be a stop share.
Resume.
Yeah, it's done.
Yeah.
Thank you so
Done.
much. Yeah.
Okay.
Yeah. There is one beautiful message asked by Dr. Harinath. I want to read that. Dr. Harinath has asked one. Does knowledge of way of kingdom selection process, PM, etc., is helping us to avoid using certain rubrics that we are hurriedly selecting for repertorization when not aware of these methods? Dr. Harinath, this was your question, or you just wanted to share this?
It is a question also, and then in the end, I feel my question can be converted into my understanding.
Yes. See, I'll tell you this as a student, even after we started practicing, this question, you see one rubric in mind section, light desire for. I remember when we go to bedside case taking and all, we used to ask as a student, and even after we started practicing, when you sleep, you want your, lights on, or you want it to be, it to be off. So we were so, we never thought beyond this repertorization. We never thought beyond this rubric can ask. Only after, attending so many other methods, when we were upgrading ourselves, we understood that mind, light, desire for can be used for people who are interested in learning, more thing. They want to, gain some knowledge. Even for them, we can use. So if it is only a light desire, you get only these remedies. But if you want to use this rubric for knowledge desire or wanting to know new things, then you go for row 5 also. So if you don't want to if you have a light aversion, then you may not want to, learn new things. So this is just the message which Dr. Harinath had put. So only if you want to learn new things, then you understand each rubric has other things also. I will not take much time because already we are short of. I have a privilege of working with a gynecologist here. Before I learned new method, nobody knew there is one homeo doctor around that area. Only after some of the, infertility cases clicked, they went back and told that gynecologist that only after taking homeopathic medicines, I could conceive. Then once she called and we spoke how it works and everything. She told me there are so many cases which doesn't have any pathology. Although I know PCOS and other things, homeopathy is having a great medicines, but I have set of cases where both are, healthy, both doesn't have any problems, but still they are not conceiving, they're not having a kid. Can I send you some cases? I said, okay, you send me such cases, I'll see how I can help them. So now I tell them, I am preparing your, uterus to conceive. It is something like that, a great message is conveyed through homeopathy that if nothing is there, you come to us, we know what to do. It is one of such cases which was referred by gynecologist. Female age 23 years, born and brought up in Mumbai, daughter-in-law of a big businessman in Chennai. So for gynecologists, it was, more challenge because a big person and he was repeatedly asking why nothing is happening. She is married since 4 years. Husband is 30 years old. Issues of infertility, both are healthy, doesn't want to try IVF. That was also one more thing, gynecologist sent that case to me. Usual my question, I ask patients whenever they come, I'll ask them what must be the problem for your, why you are not conceiving, what do you think? So she said, I am having body ache and headache all the time. I don't feel good. I don't enjoy sex. I don't know what I want. Sometimes I'm very happy and excited, but many times when I am here, I have aches everywhere. Maybe I am not ready for a child. It's not happening. As my husband is very busy, we rarely go out of Chennai. Okay. Then I told you, tell me about your childhood. So she... Dr. Namita, I had wonderful childhood. We were in Chal. No, she is from Mumbai. Chal is a housing complex. And I used to have a lot of fun. My mother used to prepare a lot of snacks, which were liked by all my friends. So all the festivals we used to celebrate together. I and my sister used to participate in all competitions. As we don't have many relatives, I don't remember going out of Mumbai. When I joined college, I had best of my life. We used to go by local trains and used to hang out in beaches and did lot of trekking and other activities. I love adventure sports. I ride bike and car. Long drives with full speed and was our entertainment. Many times my father and our uncle used to accompany us. I enjoy partying. When I was in second year of degree, I got married. First few days were okay for me. Once my husband started going to office, I understood I can't do things which I was doing in Mumbai. In the beginning, I used to go often to Mumbai just to enjoy. As day passed, I realized Chennai is not my place. No friends, no parties, no place to go. I couldn't go often to Mumbai. Lots of fights with husband. Sorry, give me a minute. I developed sleeplessness. was taking some pills. Although my family tried to keep me happy, nothing excites me. So much of boredom. Given a chance, I want to go for fast driving, eat street food. As you know, we are big people here. Can't do anything like going in a, you can't go in a train or eat on the roadside. It is frustrating. I try keeping myself happy, but nothing works. Sorry, I have told you what remedy I have given. Given to that medicine, if I didn't know all these methods, no sensation method, it was very, very difficult to think about this remedy. I gave her Reticurium marum verum, BD 2 days. After 2 months, I had to increase 1 m. Within 6 months, she conceived and delivered a baby girl. So this was possible. This is a plant and flower. And this medicine is prepared from the flower. So tell me how many of us knew the kingdom, the part they used, and how the source is, connected to the patient when we were studying or after we came out of finishing the course and were practicing. Our knowledge about source was very, very, very less. Even many people now, they ask me, is there any other mollusk other than sepia? Because not so much is taught in college and they never had opportunity to learn through, some schools. So only after all this corona and online thing, people are learning lot of, new things. So I recommend you learn new things. Otherwise, you cannot help patients 100%. Only few cases, few drugs are used. If it was not my knowledge about sensation, I don't know what remedy I would have given to this patient. So this belongs to Labiatae family and ringworm miasm. Main sensation of Labiatae family is excitement. Excitement can be vivid, pleasant, tremulous excitement that stirs one to activity. In mind, the excitement can be seen as exhilaration, rush of ideas, loquacity, singing, etc. At the physical level, it is seen as physical irritability and pain in shocks. The opposite is dullness, lack of interest, and decreased activity. So husband used to tell me, I don't know, doctor, we have so much, but nothing, excites her. Ringworm miasm lies between Sora and psychosis. The situation of the ringworm miasm seems to be one that is on the borderline of the patient's capacity, and while not threatening, it is good for him to succeed. So he tries periodically, but each time he fails. He gives up and accepts it. Thus, there are both resigned acceptance as well as the element of struggle. Miasm is something, not very well taught in our schools and in our colleges. So many people don't even aware that there are 10 miasms nowadays. They are still thinking there are only 4 miasms, and they are finding it very difficult, especially in plant kingdom cases now, to select remedies. So we are also teaching about miasm in our course. So the feeling could be there is an effort to try and get excitement, alternating with the resignation. A fixed feeling that they must put up with having no excitement. This was the cause for her infertility. Once that removed, she could easily, conceive. This brought, lot of belief in me by the gynecologist. Gynecologist was so happy. We have around 54 cases together where she referred, and I could help through homeopathic medicines. So Dr. Shankaran's work on plant sensation. If you don't know, please, my request, if you know this, you can help lot of patients. So this Labiata family, So, and we have a PM method where again this is taught. This patient, according to me, is a young adult where Labiata family belongs to Laminales family. This all is taught in our course. So according to Yakir, excitable energy that gets scattered, they want action all the time. They have a strong need to be part of whatever is going on in the center of things, in the inner circle of society. Yet though friendly, they still need their time alone. In women, polyp in the urinary system, vaginal and uterine polyps, multiple uterine polyps that prevent women from conceiving. PMS, premenstrual symptoms, uterine prolapse. Even Ange Colton talks about this drug. They are friendly and idealistic on one hand, but feel easily disappointed and complain about negative events and people. Their idealism gets them work for institutions that want to better the world, like Amnesty International, Greenpeace, the Red Cross, or Foster Parent Plan. But they're also disappointed and suspicious about people that are working for their own advantage rather than for the good cause. It makes them partially withdraw into their own world, like grumpy old men, although this is in contradiction with their friendly and warm character. Angry about everything, aggravated marriage problems, persistent fate having met the wrong spouse, female leukorrhea, yellow offensive in little girls, polyps, smooth pedunculated polyps, pear-shaped polyps, vagina polyps, protruding polyps, and uterine fibroids. See, I knew this remedy, but it was mostly I knew materia medica of this remedy in nasal polyps. But if I had not known the sensation method, very difficult to prescribe this remedy for infertility. So as we discussed, there are mainly 3 kingdoms. Today, I'm not going much into this because already we are short of time. So any question about this case? Hello. Is there anything in chat? Yes, very, very nice. It is not Piperaceae, it is Labiata. All there?
Ma'am, there's a question. Will the mental age of infancy and adolescence can be seen in the same person like multi-miasmatic presentation?
Actually, no, we are not discussing that here today. It is too advanced question. Actually, this is mainly for the, basic understanding of sensation and PM. Maybe this question I'll answer in the group. But was it, for all of you, was it easy to come into this drug? People who know about all this, sensation method and PM method must have thought about Labiata or Piperaceae. One is in a 6th column and one is in a 1st column. But was it easy? Just with the repertorization and just with this? And Dr. Karishma, that is there in JCure. That is one, there is one website, you just type Skolton, and Skolton, you will get all these informations in the Google. Karishma, I think Dr. Karishma was asking this. Qjur, yeah. Doctor, you just send your number, we will add. See what happens Somebody is asking me how you can get PQRS. It is not PQRS. My, interest to learn new things started when patient was giving too many symptoms. I didn't know what to do with. See, in infertility, if you don't have any, this symptoms of your ovaries or a uterus or a sperm, you don't know what to do. Everything is normal, but nothing is happening. And patient is giving you so many other informations. Before, upgrading myself, I didn't know where to put all these things. And gynecologist used to tell me, ma'am, she is talking about boredom and other things. What will I do with this? I can give her some injections, hormone injections, but nothing is happening. She says, I don't like, I'm not enjoying what to do. So in this juncture, homeopathy really works if you know all these methods. Only that time I understood I have to upgrade. There is something beyond all these things, Kent book and other things. I have to upgrade myself and started doing. Maybe in your practice also you have some problems where patient is not, doing well. You can think of upgrading yourself. How many of us knew lac humanum? I never knew lac humanum or lac dolphinum. Only through upgrading, I know there are so many lac remedies which, today's this, we require those remedies which, if we know only you see, otherwise you don't see. So I think we are 4 o'clock. Preeti Prajakta will not allow me to talk beyond this time. So thank you very much. So I request all of you, please upgrade yourself. And this Healing Harmony is a best platform to learn new things. And they're doing really a wonderful job. And this course is really, if you attend this course, you upgrade yourself to great extent. Thank you.
Dr. Jyoti, can we let participants to ask questions for maybe 5 minutes if they have any questions?
And do we have so much of time? Because see, don't ask me all this related, PM method and very advanced course, advanced things, because this today's platform is not for that. If you want to ask me, like what type of questions?
Anyone, if you have any doubts, if you would like to know more about the course, please feel free to unmute yourself and ask.
Yeah. Can you unmute everybody?
I think they can do themselves. I will do it. Wait.
Yes, ma'am. They can now unmute themselves.
Yeah, anybody wants?
Yes, I have a question. Thank you. I was not able to unmute. I'm a practicing homeopath, and I like very much what you presented today. I've studied the sensation method and know a lot of what you said, but not how you refined to the specific remedy. And this was very interesting. So I'm wondering if it's possible, I think probably a basic course would not be for me. Is it possible to join a study group for difficult cases or some sort of, I don't know. I'm wondering if there's something other than the basic course we could consider. Thank you.
No, this study group, always you're welcome. We have 3 groups. There is a link in the chat group. Anytime you can join through, or you leave your number, it can be added.
I'm just confused.
Lot of new things in our study group. People can present their case, and people who know new things will share. So you're always welcome, doctor. Anytime you can join.
How does the study group work? Does it meet, or is it just an ongoing thing? So we WhatsApp, or how does it work?
WhatsApp. It is through WhatsApp.
Ah, okay. Okay, so we present a
Yeah.
case and then maybe get some comments
Yeah,
or listen
people
to
who
other
would
people.
like to share their cases or their,
Okay.
no understanding of, or they have read something new, they would like to, share also, they can do through our WhatsApp group.
And can I contact to find out what the cost would be to join this?
No, it is free for.
That's what I was hoping you would say, but I need to ask.
Yeah, it is free. You're always welcome to share your case and
Ma'am, hello.
yeah.
Yeah, ma'am,
Yeah, doctor.
I'm Dr. Aditya Chatterjee. I am a practicing homeopath in Lonavala. I wanted to know about the basic course. What is this basic course that you talk about?
No, a lot of people doesn't know that this exists. There is sensation method, PM method, or there are so many new drugs added into our this. So a lot of people were asking us how to read and all. So we formulated one, 12 day course to, one day we cannot teach everything. There's so much to learn. So you can get in touch with this number, which in the chat.
The one from 8th of June, right?
Yeah, same one.
Okay, I am already there in that.
Yeah,
okay.
Thank you. Welcome.
I did not
Good decision.
Get the...
Desires for light I can see from your side. Thank you. Yeah, welcome. Yes. Thank you. Anything else, or we can? Yeah. Thank you very much. We will see you in next webinar or in basic course.
May I ask if there's something other than WhatsApp? I assume not, but I'm not so good with my phone. I mean, I can do it, but there is no online difficult case study group at all. Am I right? It's just WhatsApp. Yeah.
I don't think in our this we don't have. We have
No,
WhatsApp.
I understand. Just was hoping. Thank you.
Yeah. Thank you. Bye-bye. Thank you very much.
Thank you so much to all the speakers, Dr. Jyoti ma'am, Dr. Jaya ma'am, and Dr. Hetal ma'am. Thank you so much to all the participants as well. Looking forward for your participation in our next musing as well. Thank you.
Yeah, thank you. Bye-bye.
Bye.
Yeah.